Well, we're here with Dr. Crayle, a dentist in Graham, North Carolina. Dr. Crayle, hi, how are you?
Fine, thank you.
Dr. Crayle, tell me a little bit about your practice. Let's talk a little bit about your practice. Many different dental practices, as any business, have different philosophies, even though maybe to us patients, a dentist is a dentist is a dentist is a dentist. And maybe there's some truth to it, and I'm sure there are at the same time some differences. Some dentists do lots of work in their practice, meaning they have multi-specialties in it. They do everything under one roof for most things. Other ones not so much. Other ones are much more cosmetic orientated and really don't like to fiddle with some of the little work. Other ones do more like only the little work. Some do the little and normal work and love the cosmetic. Also, tell us a little bit about you. Maybe, Dr. Crayle, even tell us what made you becoming a dentist.
Well, okay. I became a dentist because early on I felt motivated to help people, and I was interested in health from very early on. And I like to learn about healthy lifestyle and to keep a person healthy in their body and their mind for their whole lifetime. And so this has always been an interest of mine.
Okay.
As far as the dentistry that we do a general dentistry, which is a wide range of treatments and prevention and education of the patients so that they can be a partner with us and that they can also maintain good health throughout their lives.
All right. So you're paying a lot of attention to the fact that they have what I guess you dentists call functional dentistry, that their mouth isn't full of germs and eating up their flesh, so to say, that they don't get headaches because they have too many missing teeth and their hinges, which is called DMJ, isn't aligned, and basically get the guy functioning, not necessarily yet putting a Tom Cruise or Julia Roberts smile on him.
Right, that's true. You don't have to be that to be healthy. That's true.
Okay, but if a guy wants, and says, look, I really want to change the way my smile looks, or if you see that, like, if the person would have a changed smile, that he would be probably looking tremendously better. You see, sometimes an outsider, a professional like a dentist, sees that. He goes, wow, your teeth are this way, and they're functional, and they're great, but what about if they would be this way? You would be like, blooming up. Is that something you do and pay attention to as well? And if a person wants it, can he get it in your office, or does he need to go somewhere else?
Yes, well, we do deal with some of these things. Our primary focus is to prevent disease, and then if there is disease present, of course, to treat the disease.
Right.
And we often ask patients if they would, there's something about their smile that they would like to improve. We'll certainly work with them to attain that. And we do some of the work here. Occasionally, we have specialists that we can refer to.
Great. All right. So basically good. So basically functional dentistry, cosmetic dentistry, periodontal. You do periodontal disease in your office?
Yes, we treat some periodontal disease, and we also have a periodontist that we work with if need be.
Mm-hmm. Yes. What about, if people, want to straighten out their teeth a little bit with orthodontics, Invisalign or something like that? Is that something you provide?
We refer our orthodontics to, we're very fortunate to have 4 local orthodontists in the area, and they do very good work.
Okay. So when people need orthodontic work, you do refer them out?
Yes, sir. Okay.
What about Invisalign? Are you doing that?
No, not in our office.
Okay.
The local orthodontist.
The local orthodontist does that. All right. Well, wonderful. Anything you would like to add on about something about your practice or you yourself, or a message you want to give to patients out there?
Well, yes, that much of dental disease is preventable. And yet many times the disease can start to develop and it doesn't have symptoms. The patient may not feel any pain. And just because there's an absence of pain doesn't mean that necessarily that there's an absence of disease. So we like to catch things early and repair the problems or take care of things when they're small rather than wait till it hurts. And then oftentimes it's a much larger job and it involves a lot more, something that could have been prevented.
An ounce of prevention is worth a pound of cure, I guess, right?
Yes, absolutely.
And with no doubt, the dental branch of the medical field is probably the most predictive one and most preventive one out of all medical branches, be it the stomach, the leg, the lungs, the brain, the heart, the lung, the liver, the blood. Dental, can be prevented the most, and yet everything I just mentioned is actually affected by dental work, or can be affected by a bad mouth as well. Am I right there, or am I wrong?
Yes, that's absolutely true. Recent research has shown that inflammation and infection in the mouth definitely can affect the whole body, all the systems of the body. And as the research comes out, we see a stronger and stronger links between problems in the mouth and problems in the rest of the body. The mouth, in fact, we look at as the gateway to the rest of the body. Things go in and it gets spread around and things can happen. And we want to prevent all those bad things from happening.
Well, makes sense. After all, whoever built us, let's call him God for now, but anyway, whoever built us, he put the brain in there, in the head, he put the eyes in the head, he put the nose in there, he put the ears in there. Why would he put something like the teeth in it there, which he says, oh, that's one part not important at all. He put lots of important things in that little round thing there. Well, Dr. Crayle, thank you very much. We'll speak to you more about different diseases, illnesses, and ways of treatment in dentistry and advancement in dentistry, because they have been huge as well. Bye-bye.